Hello and welcome to Long Island Talks, the show that lets you weigh in on the big stories of the day. I'm Judy Martin. Lee is off tonight. Long Island is now preparing for more cases of swine flu, following warnings that a swine flu pandemic is apparently imminent. News 12 Long Island's Andrew Enger reports on what's being done.
We're trying to get the word out that this is something we need to be on top of, but certainly we're not at the point of panic.
At Nassau University Medical Center, as at all hospitals on the island, alert levels are high with a flu pandemic on the horizon. Signs are on hospital doors reminding potentially sick patients to notify staff immediately of their illness. Hospital staff are also on the lookout for patients with signs of flu-like symptoms so they can be isolated. In addition, hospitals have also stocked up on anti-flu medicines like Tamiflu.
For our medical center, we have enough for 500 patients to be treated for a full course.
Since St. Francis Prep in Queens is the biggest swine flu cluster in the U.S., schools on the island are keeping a close eye on students' health. Some districts are even sending out recorded messages warning parents about sending a sick child to school.
If you suspect your child is getting the flu, it is important that he or she does not attend school or outside activities where other people would be exposed to flu germs.
County health departments on the island are also on high alert, coordinating the testing and tracking of probable or suspected cases of swine flu. They're having daily and sometimes hourly meetings with hospitals, schools, and police officials, all in hope of staying ahead of the virus before it infects more people.
We've been in constant touch with conference calls with New York State Department of Health. We're using our BlackBerry and online technology as much as possible.
Suffolk health officials recently held exercises dealing with a fictional anthrax and avian flu outbreak. They say that experience helped them enormously in preparing for this very real swine flu situation. Andrew Enger, News 12, Long Island.
516-393-1800 is the number to call. litalks@news12.com is our email. Joining us tonight in the studio is Sam Kille from the American Red Cross, the Nassau County chapter. And later on in the program, we'll hear from the New York State Health Commissioner, Dr. Richard Daines. Okay, are we prepared or not? Now, according to the American Red Cross, there was some action taken overnight, as I understand, in response to the World Health Organization upping the alarm from a 4 to a 5 alert. Indicating human-to-human transmission in more than 2 countries, correct?
Yes.
2 countries or more. So what is the response of the American Red Cross, and does that even go further?
Well, our initial response in this, and we've been putting out information since last weekend once this broke, and it was really just to stay in touch with our counterparts in government and to monitor the situation and get preparedness information out. After they raised the level yesterday, we've started to go into the mode of we want people to be prepared, to start thinking about their plans at home and in their businesses as to what they would do if this outbreak grows even more significantly.
Now, when you say get prepared, when we were taking a look at the website, it talked about getting stockpiles of food, water, the potential of quarantine, things of that nature. The kinds of things, or staying inside, the kinds of things that we would see before a hurricane. Of course, that's what you guys are normally dealing with. So when people see these preparedness guidelines, should they be following them right away, or is it just an early indicator? Because I think it might be scaring some people.
Well, we would hope people would be doing these preparedness efforts all the time, because you never know when any kind of disaster can happen. Of course, at a time like this, you really take a look and see, well, this is why we need to, because this did come as a surprise to most people.
So this is a reminder that we always need to be prepared.
It's a reminder to always be prepared. You know, we don't want people to panic. That's the last thing we want anybody to do. But we want people to be informed, because if they're informed, if they know everything about this disease and what it could do and how to protect themselves, then we'll be much safer and we won't have a state of panic.
Okay, so as far as the plan, preparedness plan, we've got some information. Let's go over what people, and this is a good reminder, we're coming into hurricane season in any event, so it's
Another
a good
month.
reminder, right, some of the things that you need to have around the house. So let's go over that 2-week supply of food and water. Getting that together now, you think too soon or not?
You should always have things like food and water on hand, because you never know when something can happen. You know, yes, we're not in hurricane season yet, but we have had tornadoes on Long Island. We've had some pretty bad storms and blackouts. So you should always be ready with these things. And now, with the fact that there is a disease out there and it could grow, stores could close. Or if you're sick, you don't want to be going out to the supermarket and spreading the disease.
So getting those medical items and making sure that the cabinet is stacked.
And things you don't even think about, like toilet paper, because you don't want to run out, things like toilet paper, medicine, food, pet supplies, etc. It's good to have these things all the time. Right now, during this time, you really should have it.
Are you urging the public at all to have things like Tamiflu or any kind of antibiotics, things of that nature, cold medicines?
Well, I would defer anything like that. People should talk to their doctors and find out those things. The Red Cross, we're not in the business of doing prescriptions or anything like that.
But certainly if someone is susceptible to that, susceptible to pneumonia,
they should talk to their physician to see whether or not they do need it.
Okay. Tell me about the Red Cross's role in such a situation. Should this escalate to even a wider spreading situation, what does the Red Cross do?
Well, in an epidemic or pandemic situation, the Red Cross role is really one of getting the preparedness message out, letting the public know how they can be safe, what type of things they need to do in their homes, what type of things they need to think about with their businesses. Beyond that, we play a supplemental role to our government partners, to the Office of Emergency Management and the Health Department. For instance, if they had to start quarantining mass amounts of people, which we hope isn't going to happen, but if they did, we could start to open up the supplies we have at our hurricane shelters, the thousands of cots and blankets, etc., that we have on Long Island, and give them to the medical community to help take care of people.
So you act as an adjunct, I guess.
Exactly. Our volunteers could go out and help deliver supplies, etc. We wouldn't be running any kind of quarantine facilities because we'll leave that to the medical professionals. But we would certainly provide them with the tools they need to open up their shelters.
Certainly when there's some kind of crisis, people do just turn to the Red Cross. It's just by nature for us to do that. So I suspect a lot of people are taking a look at your website. There's been a lot of fear out there, though, and
yes,
incorrect information. Can the Red Cross do anything to allay those fears? For example, we were even talking earlier tonight about what happened in Egypt, where they're just slaughtering all the pigs there. I mean,
exactly,
and that's a very outrageous situation. Yeah. But what does the American Red Cross inform the public in any way so it can calm people down a little bit?
Well, one of the best sites people can look at is the Centers for Disease Control's website, cdc.gov. They can also go to redcross.org, to our website, to see various things that you can do. People have to be careful when they're looking online. We all know that with the way the world is today, anyone can open up a blog and start posting information. Go to reliable sources. Go to the CDC site or go to the Red Cross site.
So what are you telling the public, other than being prepared? What is your role? You're obviously in contact with the government. So what are you hearing out there at this point?
We're telling people the same things that the government's telling them. One of the best things you can do to prevent the spread of disease is to wash your hands. It's a simple thing. We don't think about it. And do it properly. And teach your children to do it properly, because we all know schools can be breeding grounds for germs. Teach your kids to wash your hands for at least 20 seconds. And with children, one of the best things you can do is teach them to sing a little song like row, row, row your boat.
Sanitary. We have a little full screen there for you. You see it? Yep. Cover coughs and sneezes with a tissue. Frequent hand washing, as you said. And I guess heading to the doctor at the smallest sign here.
Maybe you should call your doctor first to see if you do need to go to the doctor's office, or the doctor might want you to go straight to the emergency room. But it's always good to, a doctor isn't going to mind if you pick up the phone and ask a few questions. Yeah,
I guess not, especially with what's going on right now.
Exactly.
Okay. Are we prepared for swine flu? That is the question posed to the state health commissioner. A one-on-one interview with Dr. Richard Daines. That's next on Long Island Talks.
I'm just trying to wipe everything down. I work at an office, Clorox wipes.
I'm washing my hands as I usually do, maybe a little extra soap. Just doing all the proper hygienic things that you should be doing on a regular basis. This outbreak is nothing more than a flu season coming late with a different strain, and I think people shouldn't panic. I think we have very intelligent people running things for us, and they're right on the mark.
Number one precaution I would recommend to anybody: washing your hands. Wash your hands, wash your hands, wash your hands.